things that I see in this physical therapy treatment world is plantar fasciitis, heel pain, and Achilles tendonitis, things that are around the foot and ankle, and also chronic kind of issues like ankle sprains and those type of things. Those are the most common things that we see, and which is most common issues that are going to cause pain in your foot and ankle. Now, the specifics of those problems are a little bit more detailed, and it's something I usually will cover depending on what the issue is, and that's the hard part to discover what it actually is. Is it plantar fasciitis? Is it heel pain? Is it chronic ankle sprains? Is it Achilles tendonitis? And they all are different. You need somebody, expert like myself, to be able to figure that out so you can know exactly what you're dealing with. The second thing that's going to be the most common cause is going to be chronic pain or chronic issues. So what that means is, like if you've had an ankle sprain and you've done it multiple times in your life, that's going to cause multiple foot and ankle problems as far as multiple ankle sprains. It's also going to cause instability in your foot and ankle. It's going to possibly cause other problems like plantar fasciitis. And so it's a big cycle of negativity you get stuck into if you've had multiple issues throughout your life with your foot and ankle that you haven't really fully addressed correctly. You know, even ankle sprains are known to be the #1 undertreated condition in all foot and ankle problems and almost all musculoskeletal conditions. The third most important thing, and this kind of relates back to everything that I normally will see, is overuse or fatigue. You know, when you're looking at Achilles tendonitis or plantar fasciitis or anything with the foot and ankle, oftentimes if you're really looking at the cause of the problems for most people, outside of a sprain, which they usually know when that happens, is going to be what we call an overuse fatigue syndrome. So for example, you stand for 8 hours at work, you've been walking for 2 or 3 miles a day, and it's new to you. You've been trying to run, so all those things are actually postural fatigue issues. When we think about posture, we think about neck and low back, but actually your feet can have fatigue issues as well based on too much standing, too much walking, too much standing, or running. Then lastly, it's going to be your shoe wear. So shoe wear is very, very important when it comes to human beings and being able to stand and walk. So all the conditions that I talked about, all the overuse problems, some of the first things I look at from any foot and ankle issue is your shoe wear. You know, there's certain shoes that we prefer typically as far as stability and kind of how it affects your foot. Orthotics and inserts can be a big issue for most people, especially as we age. You know, the one thing I tell people is that, you know, as human beings, we may at one point been able to tolerate going barefoot all the time and going through our life without any shoe wear, but you know, since we live so much longer, you know, ligaments of the foot, the ligaments of the ankle, all the tissue gets tight because of all the stuff we do as far as standing and walking. So shoe wear, inserts, orthotics can be one of those things that you have to end up doing, because if you don't have that support, you can't tolerate a 10-hour-a-day job where you're standing all day or you're trying to walk for 2 or 3 miles to get healthy. So those are the 4 main causes, foot and ankle and heel pain. If you have more questions, let me know so we can maybe get a visit together to learn more about what your issue is and how we can actually give you solutions to it. Look at our website at physicaltherapylouisville.com for more resources, and call us at 502-509-3136. Thanks a lot, and we'll see you soon.